Thank you, Venkat, and thank you, Joy, and Balu and Hannah for inviting me to be part of this. Sitting here and listening to the morning sessions, I felt I was from another planet. Absolutely clueless, which is not very different from my entire MBBS period. I grew up here and in 7th standard studying in Ida Scudder School. In my progress report, my class teacher, Elena Sen, wrote a note that was prophetic. She said, Johnny tries to use humor and flippancy to cover up for a lack of subject knowledge. Nothing has changed in 50 years. And so this one is beyond me, and I'm asked to represent the people who are not in this hall otherwise, which is essentially a huge chunk of our country, and for whom I'm afraid many of you see them only as data points, as sources of data, as rich gold mines. We have a different point of view. I would like to take off my hat of vice chairman, if you don't mind, because that cramps my style. I want to be able to be provocative and play bad cop if needed. If I offend anybody, forgive me, it is totally intentional. Let me just share where I'm coming from. Sorry, I think it's just to add flavor to this. I was asked to come in after lunch and wake you up. So where am I coming from, right? Because a story is as much about the story as it is about the storyteller, right? And so for those of you who are familiar with the map of India, I come from the state of Odisha. If you're not familiar with the map of India, it's very easy. It's a bit like this. This is Kashmir. That's Kanyakumari down there. That's the city of joy. It's easy to get. We are now standing here, but Dil hai Odisha. And so I come from here, right? It's very easy. In Odisha, you have the coastal districts and you have the interior districts. We are in a small place called Bissamcuttack, 400 kilometers from the state capital Bhubaneswar, 350 from Raipur, and 250 from Vizag. Our nearest airport is more than 7 hours away. So it's a lovely place to live. I want to speak from that perspective, right? I work at this hospital, which is just short of 70 years old, 200 beds. I did that to prove that we have electricity, okay? 6 days a week. All the data I'm showing you is for the few years before COVID. COVID disrupted everything. So we are still trying to figure out where we stand. We have 200 beds, and we've been running at 105% bed occupancy for the last 3-4 years before COVID, which means an average of 210 patients admitted at any given time. Lots of surgery, because across the country, surgery is totally underdeveloped in all rural areas. The only surgery which develops is actually obstetrics, cesareans and tubectomies. Nothing else gets done. And so we come from that side of the world. Lots of deliveries. And my work has been with the community health department, where for the last 30 years, we've been working with the people of about 54 predominantly Adivasi villages. We work against dreams, and our dream is that one day everybody will be healthy. One day everybody will be educated. One day there'll be no more poverty, no more hunger, and one day everybody can live with dignity, regardless of caste, color, creed, gender, and so on. It's a dream worth living for and worth dying for. So this is what we do. Now, how do I respond on behalf of my people to this discussion on artificial intelligence in healthcare? I have no right to respond on behalf of anybody else, but still, I'm trying to position myself there and ask, how does one respond? One of the rules when you don't know what to say is play fake guru, and I'm playing that. I've got the beard, I've got the kurta, and so just pontificate, right? So I'm going to pontificate for the rest of my time. Yeah. What one sees depends on where one is looking from. You know, your viewing point is going to determine your understanding of the reality. So what do we see of India as a country? How do we define that 130 crore people we're talking about, for whom we feel that the systems we create are just what they need, absolutely what they need? You know, God's answers to humanity's problems. It all depends on where you're looking from. I want to take you to this situation just 7 days ago, last Friday. I took this picture. We were at a meeting in a village called Kachapaju, and this is a meeting of 16 villages. Yeah. So 25 years ago, in a similar meeting, in the corner, this left upper corner here, where the people of the same 16 villages got together, 200 people, and passed a resolution to start a school of their own. Because they said every school we send our children to, they come back looking down on their parents. They come back refusing to speak their mother tongue, which is Kuvi. It doesn't have a script, it's a spoken language. So give us a school, they told me, like the school you studied in. And then maybe our dreams will come true. So they identified the land, and 25 years ago, we worked together for 2 months, manual labor, made our first building, we called it the Mahatma Gandhi building, with mud bricks and mortar, and we started a school. This year, it's 25 years. So last week, the same community got together for a meeting to discuss a variety of issues. If you look at the people, you can make out there are about 70 men and about 10 women. Again, that's very representative, very unlike the audience here. So just because we are like this doesn't mean they are like that, right? Development is defined as making other people like ourselves. And we play with ideas without realizing. So this meeting was going on. And they're discussing various issues. They solve issues that they face. So one point of discussion was that, my child has got selected for the school by lottery. But last year, I had registered my child in my village government school where the teacher comes, periodically, maybe once a week. Sometimes, daily ones usually come for about 1 hour. Now, I want to shift. What is the process? Last year when I went to the headmaster and I could take a TC, a transfer certificate, they would write it out, I come back and admit my child in this school. This year they've said it's not possible. They're saying I can't do that. What do I do? And there was this discussion. And then one gentleman was a little higher than the rest of us. He immediately said, computer, online. Because he said, what has happened this year is that the entire education system has been digitalized. So this village school headmaster he can give you a transfer certificate, it doesn't work. Because he has to go down to the town, go to a Jan Seva Kendra where there is somebody who can use a computer, get onto the portal, change that child's thing, and then only you have officially moved. And so now this child can't access education because we upgraded systems. And so he, in Kuvi, was trying to explain, what computer and online is to a rapt audience with his level of understanding. I say this as a kind of parable for us to think about the fact that everybody is not like us. And when it comes to the essential areas like health and education, we have to ask whether the solutions we produce will give or take away. They probably do both. But who are they giving to and who are they taking away from? And that's where I'd like us to focus in our thinking. There are many, many Indias. But if you like binary stuff, I say there is India and there's Bharat. For people who are from outside, it's like Germany and Deutschland. When we speak in an Indian language, we refer to our country as Bharat. And these are like alter egos. The leaders live in India, the voters live in Bharat. They meet once in 5 years, we call them elections. It is two different worldviews with many, many in between. And we have to ask, as we come out with the solutions that we're building on, I hope and pray that the solutions you work on will not rob Peter to pay Paul, will not rob Bharat to pay India. Over the years, working with systems, with a small hospital, but also with the government of Odisha, with the government of India, on various committees and stuff, I have discovered a new disease called capitalitis. It is an ophthalmic disease. I cannot see beyond my capital. So, if my capital is Delhi or Bhubaneswar or Chennai or Vellore or Bissamcuttack, that is not the question. We are constantly sitting where we are in our capital and making assumptions for everybody else. Your definition of the zoo depends on which side of the bars you're on. When you went to the zoo, you did not know the conversation which happened between the tigers after you left. We are assuming stuff. And it'll be really good if in the process of developing the tools for healthcare and AI in India, you're able to actually look at the other side and perspectives from the other side. So they call that the digital divide. Maybe a sad example is the damage to education during the COVID pandemic and national lockdown. For first generation learners of the Adivasi community that we're working with, education is the game changer. And in the name of a virus, you shut down schools for 2 years. I understand the logic. I'm a public health guy. But the people at the least risk of COVID, because of the outdoorness of their lives, actually have the worst damage to education systems. Kids were advised to procure smartphones. And networks, in our places, you call them hello points. There are these places where when the wind blows, the phone works. They're all called hello points. They're marked. Everybody knows. And you've got these kids sitting on a hill slope with a smartphone and trying to attend a class somewhere. Some got it hot. Some got it cold. These were below tree education centers we ran through the lockdown. We got them all to promise they wouldn't mention us if the police came because we were being illegal to get children to study during that time. So some got it hot, some got it cold, and some got it just right. And I can hear Pink Floyd. We don't need... The Matthew principle. To him who has, more will be given. And to him who does not have, even what he has will be taken away. Forget the gender problem. It's a 2,000-year-old issue. Now, is this just my own paranoia, right? So most of you are saying, why did they invite him? We're doing artificial intelligence. This fellow is artificial, but not. But there are many others who are asking the same question, who are worrying about an unequal world with such a lovely, powerful tool coming into our hands and what it will do. So can I share with you some thoughts which I found? Oh, thanks, Joy and Anna, for giving this to me, which is Oxfam India's India Inequality Report to 2022, which is on the digital divide. Absolutely worth reading. Fantastic amounts of data, very interesting points raised. I just want to pick up a few from this book. I'm taking the second half of this. It is not just about people who have access and those that do not. It is not just about haves and have-nots. It is about people becoming knowers and know-nots, and doers and do-nots. Those who can communicate with the rest of the world and those who cannot. They talk about the determinants of the digital divide: availability, affordability, quality of service, relevance. Is this stuff which is coming out relevant for my situation? And of course, additional dividing factors you could play with. They talk about the effects of the digital divide, Divan and Riggins' classification, into first-order defects and second-order defects. First-order defects, are the effects of the fact that access to technology is different. So inequality due to lack of access or given access. And there are grades between those, obviously. And second-order effects are where everybody has access, but the capability to use the technology is different, and therefore there is inequality. I'm just throwing these in the air because I think we need to think about these and factor these into our thinking. I'm not against AI in healthcare, please. I'm just saying that I hope all these things also get factored into the thinking as we proceed. And there's data, huge amounts of data in that report which are worth looking at. I'm just looking at the last 2 lines. In the NSSO, that's the National Sample Survey Office, if you divide by economic status into 5 quintiles, among the poorest 20% quintile, the poorest quintile, only 2.7% have access to a computer and 8.9% to internet facilities. Among the richest quintile, 27.6% have access to a computer and 50.5% to internet facilities. It's worth thinking about because, as we saw with CoWIN, the app for COVID vaccine, if access is dependent on, or the same thing about the transfer certificate of school, if access is now going to be dependent on some sort of a digital entry point, gateway, will we exclude more than we include? So that's a question we need to work on, and work on alternative gateways that ensure inclusivity. And now let me go for some wise words from the University of WhatsApp, because this is the primary source of continuing education in our country for the common man. And so I'm going to pick up some things that I'd like to share with you. Professor John Lennox from the Professor of Mathematics in Oxford University. Just listen to this, I think he's brilliant. The problem of scientism, a belief system that science is the only way to truth, that science is absolute, that philosophy is dead. But there's a problem. Science cannot explain the most important things, such as who am I, where do I come from, where am I going, what does my life mean? And I love this last line he uses. He says, science can teach me how much strychnine I need to put into my granny's tea to kill her, but it cannot tell me if I ought to do it to get hold of her property. The tools we hold are powerful, but the tool itself does not have direction. That direction is going to come from us, and we need to be careful about that. Or if you like John Oliver, in his show on artificial intelligence, again, a line I like very much. AI clearly has tremendous potential and could do great things. But if it is anything like most technological advances in the last few centuries, it could hurt the underprivileged, enrich the powerful, and widen the gap between them. It's essentially a mirror, and it will reflect back exactly what we are, from the best of us to the worst of us. And this is in the current issue of the Frontline. Arvind Narayan, professor of computer sciences, Princeton says, digital inequalities will power digital colonialism. AI is being used by courts to predict who will commit a crime, by hospitals to predict who will fall sick, and by banks to predict who will pay back a loan. It's being used by employers to predict who will do well at a job, supposedly simply by analyzing their facial expressions, body language, and manner of speech. Obviously, the data set you use to build your algorithms are going to be built with biases depending on what it reflects. And this can have life-changing implications for those, especially from smaller groups that are not represented so much in your data set, just because they are seen as deviant from the curve that you're playing with. So summing up, in my ignorant opinion, one, artificial intelligence to me is like digitalization, internet, and computers. It's a tool and not a master. It is neither good nor bad, but has immense potential for both. Two, the digital divide is an unquestionable reality. Please let's not pretend it isn't there, and let's not pretend that we have a right over everybody else's data. I worry when we talk about mandatory systems, because whenever we've done something mandatory, it is excluded. Our nation is such a lovely country, extremely heterogeneous, extremely diverse, and no one solution fits for everybody. It inevitably leaves out too many. And those who get left out are the ones who don't have a voice. And I hope that as you build these tools with AI, you will factor that in. Three, tech penetration is growing at an unprecedented pace. There's no doubt about it. In most of my villages, the number of functional mobile phones is about 10 times the number of functional toilets. So tech is moving. There's no doubt about it. There's no question there. And the language is interesting. A patient comes in with his wife wanting an abortion. He now says, pregnancy, delete karo. You know, it's so interesting how words are going. But the problem is, the top end is moving so fast. The bottom end is moving, but it's moving at far slower pace. So the gap is the one which is rising at an incredible pace. There are huge ethical dilemmas that we've been talking about inbuilt in this issue. There's privacy, data security, control over one's data. There's so many things. Commercial interests, masquerading as, CSR. There's a whole lot of stuff there. Be very, very careful what we're playing with. Number 5, good intentions are not enough. Many seemingly correct and justifiable policy decisions with technological upgrades have had the best of intentions, but the worst of consequences. They've often excluded people from benefits rather than include. Let me give you an example. Female feticide is a terrible thing. it had to be countered. Vellore was a big part of the campaign. But because we could do nothing about the cultural issue of sun preference, we chose to hit the ultrasound machine. So what has happened? Across most of rural India, the gift of ultrasonology is not available to people, even for a male with arthritis, because of the PNDT rules. We did something for a good reason, but the solution works differently. Or you look at Aadhaar card and biometrics as a requisite for food access in the PDS. What do you do if you had leprosy and your fingerprint doesn't work? Or your fingerprint doesn't work, or there's link failure on the day you go to pick up your rice, you walk 25 kilometers to pick it up. Whenever we use these solutions that work perfectly in the capital, but not necessarily in the periphery, we are in trouble. What is often not understood is that the final common denominator in most programs for the people is a ground level clerk, armed with a checklist and the register or a tab nowadays. It is finally that person's interpretation that makes a difference. You know, you prescribe minimum standards, but they become ideal standards and get mixed up. And then that ideal gets converted into a mandatory checklist that excludes people. So careful with the power that is in our hands now. Now, poverty is a multifaceted phenomenon with powerlessness and the lack of negotiating space built into it. This needs to be recognized and factored into the discussion. I hope that we will invest on building the supply side infrastructure needed with mechanisms for accessibility and affordability. Because if we don't have it, we can't use it. So that has to reach. We need to build capacity. We need to invest heavily and sensitively in school education for the most vulnerable and marginalized, along with IT capabilities. If we can't do basic primary education properly, it's not a fair game we're playing at. We have to include people from the other side of the in discussions as possible. We have to consider the possibility that data is not everything, that science is not absolute, that why is at least as important as how. You know, when companies come to us trying to sell the product to us in our hospital, they try to tell us the patient is important to them and our work is important to them, but it doesn't come through in the way the product is built or being sold. We are just a source of data, and I have a problem with that. And so please control the obsessive compulsive data collection instinct. They're killing us softly with their formats. You know, everybody is coming up with a new one. You put this and make this mandatory for every PHC in the country. No patient can be seen. And I don't know if you realize how data is created and collected on the ground. You know, you take number of malaria deaths in the country. Does anybody believe that number? Come on, yeah. Why do we do SRS and NFHS to find out the IMR if we could trust our regular data? The problem is an MIS, the Management Information Systems in the health department, is used to monitor staff performance. And if you don't like the message, you shoot the messenger. So an Anganwadi worker has an incentive to report less malnutrition. If I report malaria deaths, I'm dead. So there's no way you're going to get the data right till we say that we want to know. The biggest requirement for a good MIS is a desire to know the truth. I don't know if you've been asked this question. You in Vellore don't understand this. Junior doctors who join us ask us, did you have to make dummy charts when you were an intern in Vellore? And I said, no. And they said, really? So I said, why? What is that? In many medical colleges in the country, every intern and PG has to make N number of dummy charts per day because there are no patients. So from the name of the patient to the address to the history to the entire treatment, everything is a dummy. And you have to produce and submit these every day. That's your logbook. And you want to do research on that. You want to use that data. So please be very careful with the authenticity of the data we are playing with. Everything is not this bad. There are fantastic places. I'm saying this also is the truth. Pawan Kumar Verma in his book, Being Indian, says, we are able to be 100% spiritual and 100% immoral at the same time with no difficulty. It's amazing. Recognize, acknowledge, and factor in the reality of inequality, of caste, of gender, of location, economics, language, and how all this affects the access and the power equations. Gandhiji said, whenever you make a plan or program, ask yourself what difference this will make to the last man in the line. The last man is usually a woman. the huge potential for advance that AI offers should not leave the most marginalized worse off. It should not exclude people from what little they are able to access now. It should empower and enable the last and the least as well. It's an idea whose time has come. It can and will grow exponentially, but humanity needs to decide the direction. As my father used to say, to win a race, you have to run faster than everybody else. But you also have to run in the right direction. Thank you.
Thank you, Dr. Johnny. We will probably have time for one question. Yeah, Ranjit.
Good afternoon, sir. Thank you for the wonderful speech. You keep mesmerizing us with a lot of facts like this. I'm Ranjit, coming from Bangalore, Biomedical College. I'm also an alumnus of CHAD. This is regarding something which I faced similar to this. 4 years back, in a hamlet called Jadankule, I happened to see ANC patients, and we don't have the technology of ultrasound or anything on the field. This is 3 hours from CHAD. And there, one patient came. We have fetal movements. She perceives fetal movements. But when I'm checking auscultation, there's no fetal movement. There's no fetal heart sound. And then I told, maybe this can be a stillborn. But my PHM was like, are you 100% sure? Now, the 100% sure was because the person has to travel all the way from Jadankule down to CHAD, come do an ultrasound, convince their in-laws that, okay, this is a stillborn, which has a lot of implications in the society. It's a very simple technology that can be addressed, and I feel on the field, it's all these simple solutions that we need, rather than going beyond. And 4 years later, down the line, I was in a conference with a lot of public health technologists, and I told this is at the grassroots level, people are not addressing these technologies to come in, rather than these technologies are limited to tertiary hospitals. Their ideology is the cognitive workload of radiologists will come down with better technologies. But I told, why can't you find simple solutions to this? And one of the delegates gave a grin, and it gives a chill in my chill today. And after the conference, he told me something like this: we were able to do philanthropy only because we were a profitable institution. If not, we cannot create a device like this, and we will always go behind this disease called capitalitis. And what I want to ask as a question is our present country in the socio-political environment conducive to bring these kind of technologies to bring down the divide, at least at the baseline, at the primary care level?
I think whatever you say about our country, about one part of our country, the opposite will also be true in another part of the country. We are such a fantastically diverse country. So I think yes and no. That's the obvious answer to that. Thank you.
Thank you very much, Dr. Johnny. I think we're in the interest of time.